The vaccines for kids have landed. Tens of thousands of appointments are already lined up. With us for all those questions everyone may still have about it. In Dorchester, Ontario, Brenda Coleman, clinical scientist at Sinai Health, specializing in public health and vaccinology. And in Ontario's capital city, Dr. Tara Kiran, family physician at St. Michael's Hospital and Fidani Chair in Improvement and Innovation in the University of Toronto's Department of Family and Community Medicine. Hi to you both.
Good morning.
So I mentioned to you before we started taping that, there's a lot of parents who have been waiting for this moment and very excited about this. But then we also have parents who are a little worried about getting their kids vaccinated. So we wanted to have this discussion to just clear up any questions that anyone has. Brenda, I wanted to start with you. Heading into the holiday season across Canada, the infection rate of COVID-19 among 5 to 11-year-olds is higher than any other age group. Why is that?
Mostly that's because they're not vaccinated yet, and most of the rest of us are at this point. The other thing is that they are close together with one another at school and while they're doing sports or dance, whatever they're involved in. And they don't always remember to socially distance and wear their masks and that sort of thing. So they're active, they're around each other, and it puts them at risk.
And Dr. Kiran, school's been in session for a few months now, and we know that the risk of facing serious COVID-19 symptoms and potentially ending up in hospital actually increases with age. Given that, why is it that important that children get vaccinated?
That's a great question. I hear often from parents, why do I really need to get my child vaccinated? Doesn't COVID just a mild illness for kids? And it's true that for many kids, COVID can be mild, but not all kids. Many kids have experienced hospitalization or a more severe illness. Some have even passed away, unfortunately, and there have been 17 deaths due to COVID in Canada, and that's just 17 too many. In addition, we know that many kids who have COVID actually continue to have symptoms for weeks or months. And so the rates of long COVID, we think, are anywhere from 4 to 25% in children. When I think about my own kids, I don't really want to roll the dice to take any chances. We've protected them against things like chickenpox, which is actually less deadly than COVID. For me, it was an easy choice to say, let me protect them also against COVID.
You mentioned rolling the dice. I think there are parents who feel like they might be rolling the dice by getting their kids vaccinated. I remember when I had my two kids in two different countries and I had surgery, and before we left the operating room, they already received a shot, and I think it was for vitamin K. How important is it to communicate that information to parents right now, Dr. Kiran?
So the vaccine is effective and it's safe. And we've got lots of data to show that. We've also got years of scientific experience. And one thing that I'd say to parents is it's really important to get your information from trusted sources. We know that there's a lot of misinformation out there on the internet. So if you are looking for trusted sources, and later on I can recommend some, please do look at those. I think what I'd like to emphasize around the safety is, it's been studied in a trial where it was given to 3,500 kids. And then in addition to that, now we've had almost 3 million kids in the US receive the vaccine. And yes, there are side effects, but these side effects are generally mild and limited. So the most common side effects are pain at the injection site. Some children get fever, some children might get a headache or fatigue. But these often these are generally limiting to 1 to 2 days and can be treated with over-the-counter medications like Tylenol or ibuprofen. There are some rare things that parents worry about, and I'd be happy to talk more, Nam, about those.
Brenda, when we talk about side effects, we've been hearing about a condition called myocarditis for kids older than 12 who've gotten the vaccine. What is that?
So that's inflammation around the heart, and it's generally, we haven't had any reports that it's caused any deaths, but it does cause issues with the child, and they're often hospitalized just as physicians watch to make sure that nothing untoward happens with them. However, this condition is much more common in adolescents in general, when they're infected with the virus. And it does happen after the vaccine. It happens in about 9 to 50 per million. The thing that I want parents to understand is that it's much more common if the child develops COVID. We can see it in somewhere between 4 and 40% of adolescents after they've had the actual infection. So it's another one of those things to say, yes, you can get it after the vaccine, especially if you're a teenager, you're much more likely to get it if you're infected with the actual virus.
Dr. Kieran?
I just want to build on Brenna's comment there. It's important for parents to also realize, so first of all, as Brenna said, this is a rare side effect that was occurred, and 1 in 10,000 at most, in that 12 to 15-year-old male age group. But it's much less likely, as Brenda said, to occur in the kids' vaccines for 3 reasons. So first, the kids' vaccine is 1/3 the dose of the adult vaccine. And we think that the risk of myocarditis is dose-related. So that means it's less risk because we have less of a dose. Secondly, as Brenda said, physiologically, it seems that teens and adults actually have higher risk of myocarditis in the general population, even pre-COVID. And so that the risk of myocarditis physiologically is just much less in 5 to 11-year-olds. And then lastly, the government has recommended, so the National Advisory Committee has recommended that we have an 8-week interval between the first and the second dose. And one of the reasons for that recommendation is to lower the potential risk of myocarditis.
An Angus Reid poll from last month showed that about 54% of Ontario parents with a child who is between the ages of 5 to 11 would get them vaccinated right away. What concerns are you hearing from your patients who are parents, Dr. Kieran?
So I think a really common one is that parents feel that the vaccine hasn't been studied for long enough. Another common one that we hear is, that it's going to affect fertility. So I just want to address both of those right now. So for one, you're right, this is a new vaccine. But at the same time now, we've had experience with mRNA technology since about 2013. And at this point in time, there have been billions of people around the world that have received an mRNA vaccine. The mRNA does not stay in your body, and it does not give you long-term changes in hormone levels or fertility. It's true that some people experience temporary changes in their menses following the vaccine, but that's just, many people, when they experience stress, get a change in their periods. And physiologically, many kids, in that preteen time have periods that are a little bit wonky. So there's nothing for us to be concerned about from a fertility perspective with the mRNA vaccines. And even though there are no long-term studies, all our experience with all sorts of vaccines, including mRNA vaccines, tell us that there's nothing that we need to be concerned about from a long-term perspective. If anything, what we need to be concerned about is actually the long-term effects of a potential COVID infection. We know that risk of that is actually very high compared to any kind of minuscule theoretical risk, which is, I think, absent for long-term, in a long-term sense from the vaccine.
Brenda, we've heard from a lot of parents who say that when it was their turn to get a COVID vaccine, they did it. They were eager to do that, but now that they're thinking about getting their kids vaccinated, they're a little bit hesitant. How would you explain that?
Because we are parents and we do the best to protect our children, right? The best thing we can do, one of the best things we can do, is to make sure that we are vaccinated ourselves and that all of the adults around them are also vaccinated. And the other thing is, we're just protective of our children, and I don't blame everybody for doing that. But as was already discussed, this vaccine is safe. Getting the infection is not. So I think it's it's about protecting your children. So have them vaccinated.
I'm really glad that we have this opportunity to talk about the side effects, because I think there's just been if you read the stuff that's online, it's a lot of people say, oh, well, we're not going to talk about, the doctors are not talking about the stuff that's really happening. But you've said, Brenda, that it's important that medical professionals don't sweep side effects under the rug. Why is it important that we talk about them openly?
So that people can be ready for them. We want to have people aware that they will happen. You are probably going to have a sore arm. You may develop a fever, especially after the second vaccine. We can't pretend these things don't happen. People need to be aware that they may happen. And I think being informed is ultimate. But we also need then to say what might happen if you aren't vaccinated. So as long as we're fair, people will believe us because it's true. We're talking about everything.
But there is this idea that this hasn't been happening for a very long time, and we don't know what's going to happen a year or 2 years from now. How do you counter that?
We've been using these vaccines in adults, and it's the same vaccine, but at a lower dose. And we have the technology. We've been vaccinating people for over 100 years for a number of different diseases. We know what's going on. And although it might be not normal for people to say this, your government does not want to make you sick by giving you a vaccine. And whether or not we want to talk about it, the pharmaceutical companies are not going to give you something that is going to have you turn around and sue them because you've injured yourself or your child. We're not out there to harm people. We're out there to save their lives.
And Dr. Kieran, Brenda mentioned the government, the provincial opposition party leaders are calling on the Ontario government to add the COVID-19 vaccine to the existing list of mandatory school vaccinations. Is that a good idea?
So adding vaccines to the school mandatory list for schools will increase uptake. And I think it's a good idea for those 12 to 17, because it's now been 6 months or so since those individuals have been eligible for the vaccine. They've had lots of time to do their research and see others get the vaccine and hopefully follow suit. I think for kids, it's a little early. We just got the vaccines, for 5 to 11-year-olds. But I think it would be great to contemplate having it as a mandatory vaccine, for example, sometime in the new school year in September. What we know is that'll help to counter any kind of complacency. So there are people who are actively opposed to vaccines, but that's actually a small minority. I think for many parents, some are gung-ho, but then there's a large group in the middle that are maybe thinking about it. And I think that kind of policy change can push them a little bit further. And I do want to say that as well, if we make it mandatory, it's not that people don't have any choice. It just makes it a lot less. It makes it a lot harder for people to not get vaccinated because you have to go through a number of hoops to say, why it is that you, for example, need an exemption.
And Brenda, if the overwhelming majority of children in the province get vaccinated, will the province reach herd immunity?
Oh, that's a tough one. I'd rather expect not, just because our level of immunity drops, and if people don't get their boosters, we're going to run into trouble. We're going to have people who are unvaccinated or less than ideally vaccinated coming into the country and traveling around the world and bringing in other variants. But it will certainly help a lot. It's going to reduce the number of infections in the province and in the country. It's also going to reduce the number of variants that we produce within the population of Canada and Ontario. We have to, although, worry about those variants being produced elsewhere and being brought into the country. So I don't know that we're going to reach herd immunity, but I think we'll get pretty darn close if people keep up with their booster shots as well.
I just saw Dr. Kieran raise her hand. You wanted in on this?
Yeah, so I just wanted to chime in here to say, when we talked before about the benefits of vaccination, I think we really focused on the benefits to the child, and we talked about how it protects them from serious illness. But I wanted to jump in here to say, it also means that if your child gets vaccinated, they're less likely, for example, to miss in-person school. Your family is less likely to be inconvenienced because your child has gotten COVID and you now all have to self-isolate for 10 days. or more, depending on how the infection occurred. And then it protects your family because, many of us have members of our family that are older and whose immune systems aren't as strong as kids' immune systems. And so even though they're vaccinated, there is risk of breakthrough infection. And kids are often the people that are bringing that infection home. And then finally, getting kids back to normal activities, and then getting all of us back to normal activities. So even if we don't reach the magical herd immunity, we're going to get, as Brenda said, pretty darn close with continued vaccination and continued vigilance about other things as well.
Brenda, you mentioned boosters, and we've been having this conversation around vaccine inequality. There are a lot of countries around the world where people haven't even received their first vaccine. So how can we accept the fact that many Canadian 5-year-olds might be receiving their second dose when an elderly person in a developing country may not even have had their first dose?
That is an issue that is beyond my ability to talk about. That is definitely a political issue, and whether or not the governments of those countries are willing to protect their own populations. And we would love to help them, and I know that the Canadian government is doing what they can to support other governments vaccinating their populations, but essentially that's up to those governments.
And Dr. Kieran, we know that this COVID is not going away if all the countries haven't eradicated it. So how can we be okay with giving a vaccine to 5-year-olds when people around the world who are more vulnerable haven't received their first dose?
So I'd say to parents out there that the government of Canada has already purchased a vaccine for your child, and it's going to be here in Canada. And you declining that vaccine is not going to, unfortunately, help people in other countries get the vaccine. And the same thing is true for booster shots. We've got those doses here, and and the government is not sending them elsewhere. So, the solution to global vaccine equity, which is extremely important, lies more in patent release and allowing, for example, manufacturers in low and middle income countries to actually manufacture the vaccine for themselves. And so, I got my own booster or third dose, as I think many prefer to call it now. I got my own third dose just a couple of weeks ago, and I was feeling guilty. Colleagues of mine said, don't feel guilty, and because the vaccine has been purchased for you. And, to assuage, though, the guilt I did feel, I donated to UNICEF, one of the many organizations doing good work to try and get vaccines in low and middle income countries.
As cases are going up, especially with this age group, we're heading into the holiday season. It's also flu season. And I think there's a bit of confusion. I had my children vaccinated on Saturday, and then I found out that you're supposed to space them out for 2 weeks, so they can't get their flu shot and they can't get their vaccine for COVID for another 2 weeks. Can you clear that up for us, Dr. Kieran?
Yeah, terrific question, Nam. So NACI has said that for adults, co-administration of the COVID vaccine with another vaccine is just fine. For kids, they've said, out of an abundance of caution, we recommend a 14-day spacing between the COVID vaccine and any other vaccine, including the flu shot. Now, having said that, it is a recommendation, and my hope is that it is not a contraindication. And my hope is that there's flexibility. I can say this because our own kids got the flu shot on Friday, and we booked them for their COVID vaccine on Friday and Saturday, respectively. We couldn't get 2 spots side by side, but we think it's that important that they get that vaccine as quickly as possible to protect themselves and to protect those of us, those people around them.
Thanks for clearing that up. Brenda, when the health minister announced we would start vaccinating 5 to 11-year-olds, she said that this represents a bright light at the end of the tunnel. Do you see the end of the COVID-19 pandemic tunnel?
I don't see it yet. As I said, with the variants out there and the fact that we do have a number of people who are unvaccinated and the fact that there are millions and billions of people around the world who are not vaccinated, I do not see the end of the COVID tunnel. It's highly transmissible, and we do have breakthrough infections. So I don't see the end yet. But my goodness, we're getting close to that herd immunity when we get if we get a large proportion of the 5 to 11-year-olds vaccinated. I think we're getting darn close.
Dr. Kieran, I'd like to ask you the same question.
I'm hopeful, and I do see the end coming soon. I mean, I know that's hard to believe because we said it, I think, a year ago when the vaccines came out for adults. But what's impressed me is that, you know, we're almost at 90% of people in Ontario having at least their first dose. I think it's 86% who fully vaccinated, and that's of those who are eligible. And now we're going to do 5 to 11s. We've also been really prudent, I think, in the way that we have reopened. And I think people are continuing to be careful around large gatherings and things they know that are risky. And so I think if we manage this winter well, we're going to be in good shape for the spring and the summer to come. It's true that there's still issues globally. But I think more and more we're going to be returning to our pre-pandemic life. I'm hopeful for coming this summer.
And Dr. Kieran, how would you be explaining this to your kids? Are they excited to get the vaccine?
They've been following COVID along. And so, yes, they are excited. You know, I'm lucky, though, my kids don't have a lot of fear or anxiety about needles. And I know that's something else that parents are struggling with. But just to say to parents that there are lots of techniques to prepare your kids if they do have fear and anxiety about needles, talking to them about the importance of the vaccine for their health. I think all kids can agree that they didn't like online school and they don't want to go back to that. So this can help them to have a normal life. And, you know, if they're worried about pain, you can buy one of these anesthetic patches or creams at the drugstore and talk to them about distraction techniques and breathing techniques and relaxation techniques during the appointment that can actually help them get through. And then finally plan a reward. So we're definitely going to plan something special afterwards. Not sure what it'll be yet. Maybe a fun movie night, some treats, who knows what else, but we're going to do something fun to celebrate.
So Brenda, when we got our vaccines, it was a little bit like the Hunger Games. And I think the situation has changed for children. If parents want to get their kids vaccinated, where can they find information on how to do that?
So I think the best thing to do is just to go online and go to the Ontario Ministry of Health website, and they will then direct you to the public health unit in your area, because things are being vaccines are being distributed differently in different health units. So there are mass clinics. You can get it from pharmacies. The schools at some point in the near future will be offering them. But is that the principals of each school, if there's going to be a clinic at the school, will be sending a notice out to parents. So go to the Ontario Ministry website. There are a few others out there. There are spaces available. So go online, have a look, and get your child vaccinated right away so we can all enjoy a great Christmas.
And Dr. Kieran, if parents still have questions or concerns, where can they find more information about the vaccines?
So there's some terrific websites out there. Max the Vax is a new website that's been put together by Amanda Adams, a family doctor in Markham, with sponsorship from the Canadian Medical Association. And they've got lots of answers to your questions, as well as terrific interviews and video recordings, both for parents and children directly. Kids Health First is a terrific website put together by the provincial COVID-19 vaccine table for children. And if you just go on their website, Kids Health First, and click on parents, they've got tons of information about the COVID vaccine. I myself have been part of a group that's where we host a lot of our information that we've put together at the University of Waterloo School of Pharmacy website. If your child has anxiety with vaccines, then check out Immunize Canada or immunize.ca and their CARD, C-A-R-D, resources. And then lastly, you know, if you feel like you want to speak more about the vaccines, please book an appointment with your healthcare provider. And if you know you're having trouble doing that, please, you know, actually reach out to that Hospital for Sick Kids vaccine consult service. It's a terrific resource where you can book an appointment one-on-one to talk to a healthcare professional who can answer your questions directly.
Well, thank you to both of you for explaining, getting into this topic with us. We really do appreciate your insights, and I hope that the parents who are watching, this gives them a bit of room to breathe. Thank you very much.
Thank you.
The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism.